Good afternoon, everyone, and happy Friday to you. We will wait here a few minutes while we have everybody enough time to join. See the number of participants continuing to pick up here, so we'll give it just a minute. Blanca, like I said, if we have some questions along the way and they're relevant to something that you just discussed, I'll probably just try to interrupt and ask that question before you move on, as opposed to saving everything until the end. Great. Good afternoon, everybody, and welcome to day 5 of the Georgia HFMA Virtual Payer Forum. My name is Bill Eichest, and I am your moderator this week for the Payer Forum. It's a pleasure having you all with us. I recognize several of the names from earlier in the week, so thanks for coming back for another session. I hope the week has been productive for you. Certainly, thinking about all of you during this time. I imagine many of you are working from your homes, some of you in your offices and whatnot, and just really glad that you're able to take some time to join us. Obviously, we would prefer to meet in person, but during these times, it just requires us to innovate a little bit, improvise, and so we felt like these payer forums historically have been very valuable for both the providers and the payers, and we felt like it was important to continue to host these for you. It's a busy time, but Georgia HFMA has a long-standing commitment to cooperation and collaboration with the payers in the state of Georgia. As many of you know, we've had 5 different payers this week. There were some additional payers that you probably were expecting that maybe you haven't seen this week, and I apologize for that, but we did have some folks that just were not able to commit to the time frame or commit to the presentation this week. But I encourage you to really use Georgia HFMA as a resource anytime you're having any issues, to bring those issues to light, so that we can work together to try to help bring some resolution to some of those issues. So, as I said, my name is Bill Eichest. I'll be moderating the session today. Here we are already on Friday. Happy Friday to all of you. I'm excited for tonight. The Atlanta Braves are up 3-1 in the National League Championship Series. So if the Atlanta Braves are your team, I hope that you'll root them on tonight, because after tonight, they could potentially be in the World Series, but they have 2 more shots to try to make that happen. Hopefully we get it done tonight. I would ask that during the presentation, if you have any questions, please submit those questions in the Q&A section at the bottom, and I will pass those along to our presenter. So again, welcome. The presentations will be posted on the Georgia HFMA chapter website. We have most of the presentations and the webinar recordings out there for you already today. But Blanca has promised that she would provide me with some information for Ambetter, and we'll be sure to get that information out there just as quick as we can. I will show you at the end of the presentation how to access those documents and those videos recordings if you don't have that opportunity already. So, all right, so with that being said, I want to welcome Blanca Rodriguez from Ambetter. As many of you know, Ambetter is part of Centene and also the Peach State family, and so she has some good information to share with you today. I would ask that you, again, please feel free to enter any questions that you might have for her. She'll do her best to answer those, and of course, anything that she's not able to answer, we'll get some follow-up information, and we'll include that with the other documents on the chapter website. So, with that being said, I'm pleased to welcome Blanca Rodriguez from Ambetter. And Blanca, thank you again so much for participating today.
Yes, thank you so much for having me. I'm excited to be in this forum again with everyone and being able to represent Peach State Health Plan Ambetter. And with that said, I will pull up my presentation so that we can get this up on the screen. Is everyone able to see the presentation?
Looks good on this end.
Okay, awesome. So yes, my name is Blanca Rodriguez Russell. I am with Peach State Health Plan, and I represent Ambetter, Peach State Medicaid, and Allwell as well. Today we'll be talking about Ambetter only, and I have our little slideshow to go over that with you guys and kind of bring you up to speed. And this is always something that we kind of share with all of our new providers as an orientation, so this would be great to share this with you all as well in this setting. So with that being said, let's start. So we're Ambetter at Peach State. And I'm going to skim through some of the slides so that we can kind of spend a little bit more time on the more important stuff, as I'm sure everybody really likes to talk about more about claims and eligibility and things of that nature, authorizations and stuff like that. So who are we? So we're Ambetter from Peach State, and we are a market-leading affordable insurance health plan, and we provide affordable health plans to our members here in Georgia and other states as well, and we are part of the marketplace. The objective of Ambetter is to increase access to quality health insurance and improve affordability. This just kind of gives you like a small breakdown. I won't go too much into detail. We know that Ambetter has subsidies and things of that nature that help our members qualify and get their premiums paid. And this kind of goes into that same thing. All right, what do we need to know about Ambetter? Here's some key contact information, and when I provide this to Bill, he'll put this out there so that you guys will have this, just some phone numbers and websites to share how to get access to our web portals and being able to access our provider manuals on these specific links. So you guys will have this once he posts this presentation out there that will be accessible to you all. Okay, as a new provider, when you join Ambetter, you should be receiving an email, a welcome email with what we call a toolkit. The toolkit normally comes with a welcome letter, and it just provides some brochures. It tells you how to set up, gives you some of our vendors, how to set up with our vendors, quick reference guides, and like a prior authorization guide as well. So all of those come in your little packet, and that we call those a toolkit. And you should get that via email, and sometimes they'll even mail it out. This also just kind of breaks down our provider manual, which is accessible on the unsecure side of our website. And of course, our manual will have all of the good breakdowns on network billing guides, time frames, authorizations, how to file for reconsideration, important addresses to know, and things of that nature. So that's all can be found on the unsecure side of our portal. I think I skipped one. When you come on board with us at Peach State Health Plan with all products, you're always going to have what we call a dedicated provider relations representative, which assists all of our providers. We work as a liaison internally to be able to review claims, have monthly meetings, even monthly meetings where we get together and see each other and go over any type of barriers, issues that need to be addressed. We'd like to address those immediately. And get that rectified so that things can run smoothly. So always look for your provider relations representative. I'm over the key account hospitals here of Atlanta, but we've got reps that manage the counties all over Georgia, and we have a territory list that's out there on secure website that lists who assists who in what county. So if you ever need some assistance somewhere, please go out there and take a look and see what county you're in and who is your dedicated provider relations representative to assist you with all your needs.
Blanca, can I interrupt you for just a minute?
Yes.
How many representatives are there across the coverage area in total?
I think I want to say there's like about 35 of us because we have people in Atlanta that service all of the counties in Atlanta. Then we've got, you know, people out in the South region, the North region, the Macon area. So we've got reps that service all the areas in Georgia. We've
And
got
all types of business. I think most of the people today are hospital related, so they're covering all types of services, including of course, the hospitals. Okay, has that number probably grown a little bit in the last year? Because I remember early on there was some discussion about just getting in touch with people and hearing back from people. Is that not saying that's continuing to happen, but is that better? Or do you have more representatives now than you did even maybe say a year ago with that to cover the area?
I think we do. I mean, we've normally always been well-staffed to be able to service all of the counties and hospitals and everywhere in Savannah and stuff. But again, if you guys are having barriers with people not being responsive or something, please let us know. Those things are very important, and we can definitely address that and ensure that you guys are getting timely responses, because we're held definitely internally to a standard of when we need to be responding back to our providers, for sure.
Absolutely, and I appreciate that feedback. And that's what I would encourage the attendees today, is just to make sure to escalate any issue that they're having if their representative for whatever reason is unresponsive. This is a general statement, but I think one of the things that we've heard over the years from regarding the different payers is that sometimes folks are following up and not necessarily getting back the response in as timely of a manner as they would like. So if anybody has an issue with that, as Blanca has said, please don't hesitate to escalate that and let them know that you're having.
Definitely escalate that over to us, and I will definitely triage that to whoever department it needs to be triaged to. But yes,
great.
We are definitely,
thank you so much.
That's definitely one of the most important things that that is a part of being a provider relations team, is being responsive to all our providers and making sure that we stay true to our word, that what we're able to do and what we're not able to do right away.
Thank you.
Yeah, absolutely. Okay, so this is our website. This is just the Unsecure website. And like I said, here you guys can find payment policies, clinical policies, forms, claims forms, reconsideration forms, outlines different addresses to send your reconsiderations to. All of that good stuff is found on the Unsecure side. You don't have to log in to be able to have access to all that. And of course, our provider manual. I just kind of broke that down for you guys, what I just said now, what you can find on the public website. This is what our secure portal looks like. And if you don't have access to the secure portal, I highly recommend that you please create an account. They recommend that everyone create an account with their own unique email, because those emails are also used to send out communication as they come in. Whoever has a registered account, those emails are put into a bucket. So when we do email blast, all those emails get, anything new that's going on with the plan, any new payment policies or any changes and things of that nature go straight to all of those that have created an account. So it's very simple. You just fill out the form, email, they'll send you a link. You respond to the link, approving that you want to be a part of the registration, and then you're able to go into the secure portal. And once you sign in, that's when you'll be able to have access to claims, authorizations, member information, and all that good stuff. So basically, I jumped ahead always, but this is what I just said. You have access, once for the secure portal, you'll have access to health records, care gaps, authorization, submitting one, seeing where it's at. We now have access to submit a reconsideration. You can see where it's at, what progress it's at, and the disposition of your reconsideration and all that good stuff. So it's a really great tool to use. I highly recommend that everyone have access to it. You can also, of course, submit your claims and then be able to see the disposition of your claims as well. So this is basically what I said, some insightful reports that you're able to pull once you have access to the secure portal. This is what an Ambetter member ID card looks like. You've got the magenta colors, and I think, all well is the grape color, and then we've got Peach State Health Plan, which is the orange peach. Ambetter, all member eligibility is verified on our secure portal. We already know that Medicaid, we use GAMIS, but for Ambetter, you should always verify eligibility every time a member schedules an appointment, and of course, when the member arrives. And this would be the tool, the secure portal would be the tool where you would go and verify member eligibility. Panel status can also be assigned to the patient, and it can also be done via the secure portal as well. And this is mostly of what I just said. You can verify eligibility through the secure portal, which is what I highly recommend. 24/7, we have an interactive voice response system that you are able to call and get information and feedback on eligibility on the member as well. This is what the eligibility check screen looks like. You add the date of service, the member ID, or the member's last name, the date of birth, and then you click on check eligibility. And a green thumbs up means the member is eligible. Red thumbs down means the member is not eligible. And this is what it looks like once you're in and the patient is eligible. You'll be able to see their cost sharing, their benefit tracker, health records, authorizations that they've had in the past, any medications and pharmacies that the member goes to, referrals, and it just has good stuff, claims that have already been previously submitted for this member. Everything is able to be on here. And then you have the summary of benefits. I think it should show you. So the summary of benefits, that's what I wanted to show you guys. That hyperlink is really awesome. You click on that. As we know, our members are going to qualify for different services and different types of packages. So when you click on the summary of benefits, it kind of gives you an overview of what that specific package entails, visits and therapy visits and all of those things. It's a great breakdown, so I highly recommend that when you're going through the secure portal and you have a member, that you go ahead and verify their eligibility, but also take a look at the summary of their benefits and see what kind of package they have. As we know, we educate all of our members to seek, primary care providers when they need, immediate medical assistance. However, in the event that any of our members need to go see a specialist, we do not require a paper referral. So as long as our providers or the provider that the member is choosing to see is in network, with Ambetter, they are able to go and make an appointment, and it'll be business as usual. Claims will be submitted and processed and paid, business as usual. Okay, so prior authorizations. If you need a prior authorization, of course, it can be requested either through our secure portal, you can call it in, or you can fax it in. Those are our three ways to submit a prior authorization. Our pre-authorization tool I love very much. When in doubt, please go out here and go to our pre-authorization tool, type in your CPT, and it'll prompt you to ask a few questions. And once you do that and you enter your CPT, it will let you know if the CPT that you're gonna bill requires an authorization or if it does not. And if it does, it already has a link out there where you click, and then you can go ahead and start your prior authorization form filled out and get it in progress for whatever service that you're billing. But this tool is a really great tool, and it works very, very well. And that's on the unsecure side, by the way. You don't have to log in to get access to this tool. This tool is on the unsecure side of the web portal. So what things require authorization? We've got the high-tech imagings, we got OB, ultrasounds. One is allowed in a 9-month period, and for anything urgent, emergent ultrasounds, use the best clinical judgment. If you need more, of course, call in and speak to one of our clinicians, and they can go ahead and get that service approved if qualified, of course. But those will be some of the things outside of, observation stays exceeding 23 hours, anything emergent, newborn deliveries, things of that nature, of course. All inpatient services we know will require an authorization to obtain one in order to get those services that will be billed paid. Same thing, ancillaries, DME, home health services, hospice, and things of that nature. So service type and turnaround times, scheduled admissions, we require a 5 business days prior to the scheduled admission date. Elective outpatient services, the same thing, 5 business days prior to the outpatient date. Emergent inpatient admissions, we require a 1 business day notification. Observations, 48 hours or less, a 1 business day notification. Observations greater than 48 hours requires an inpatient authorization within 1 business day. Emergency rooms, maternity admissions, newborn admissions, NICU and outpatient dialysis, all 1 business day. Utilization determination timeframes, anything prospective and urgent, give us 1 day. Non-urgent, prospective non-urgent, 2 days. Emergency services, 1 hour. Concurrent and urgent, 24 hours. And retrospective, 30 calendar days. Prior authorizations will be granted at the CPT level. If a claim is submitted that contains CPT codes that are not authorized, the services will deny. If additional procedures are performed during a procedure, please call in and update your authorization. So when those services and the claim comes over, it's billed and you won't have any denied claims, denied services, and the claim can process and pay out. But we will have to be updated when at least 72 hours of the procedure. Many times, things can happen during a surgery that are outside of all of our control. So we totally understand that, and we understand that there are circumstances that will require just a phone call, have your existing authorization updated, services that changed from one thing to the next or added on to your authorization, and just get with our clinicians and they'll go ahead and get that updated and provided to you right away. Ambetter will update authorizations but will not retro authorize any services. The claim will deny for lack of authorization. Of course, as I said, if there are extenuating circumstances that led to the lack of authorization, the claim may certainly be appealed. And this is a great opportunity to please reach out to your provider relations representative, follow the appeal process, but also use your provider relations team to assist you internally to get these things executed rapidly and your claims reviewed.
Blanca, is that an issue that you deal with your provider contacts a fair bit?
Sometimes, absolutely, sometimes.
Is there any common denominator, common issue that you're finding they're running into that would prevent them from obtaining that retro authorization? Anything?
Some of our providers, patient goes into the ER, becomes an inpatient, services are rendered, and then we don't get any follow-up for an authorization. And then I think what happens is some of the providers feel like, oh, you know what, we only had a 24-hour window, now we're outside of the 24-hour window. Right. It's now 30 days, 60 days. I'm just going to appeal it, but we're not going to make no attempt to call because we're going to get denied and rejected for a retro auth. But guys, that's certainly not true. Again, there are extenuating circumstances that are outside of our control. These policies and procedures, of course, are out here as a process, a seamless process, but if there's something that's going on, please reach out to your provider relations representative. Definitely get with them. Still follow the appeal process, but reach out and let us know. We can get you in contact with the appropriate medical management team to say, hey, this service was performed. It was emergent, inpatient. You know, this is what's going on. No authorization was obtained in a timely fashion. However, they're appealing within an appropriate time frame, and we want this claim to be reviewed and have their clinicals reviewed and move forward on that angle. So I say to say, please don't let, what's already written stop you from moving forward and obtaining what you need to obtain to get that claim processed and paid.
Yep. Thank you.
Yep. Claims may be submitted in 3 different ways, either the secure portal, electronic clearinghouse, or of course by mail, whichever you guys prefer. And then at the top, it just says the timely filing deadline for initial claims is 180 days for Ambetter. And this is a little bit of what I spoke about: claim reconsiderations and disputes. A written request from a provider about a disagreement in a matter in which the claim was processed. No specific form is required, but must be submitted within 180 days of the explanation of payment. So we've got now, the secure portal is now equipped that, let's say you go out there, you log in, you look at a claim, the claim denied, I don't know, untimely. You don't agree with that, there is already a button out there that you can click to take that claim and file a reconsideration for the claim, and of course, dispute whatever you didn't feel was favorable for you, and you can start tracking it. It'll just let you know in what process your reconsideration is in. Ambetter has a level 1 and a level 2. Level 1 will be your initial dispute, and if that comes back unfavorable, you have a level 2. And sometimes people will dispute using medical records at that point and whatever else is required to prove your point, and then there's your appeal. So a level 1 and 2, you exhaust your reconsideration and dispute avenue, and then we move over to appealing the claim.
So 180 days from the initial, 180 days to file the initial claim from date of service, but then an additional 180 days from the time of a denial to appeal that denial.
Correct. So you have 180 days from the date of service to file your claim initially.
Right.
The claim denies today, October 16th. You have 180 days from October 16th to file your level 1.
Yep.
When you get the disposition of, or you get a response to your level 1 submission, you have another 180 days from that response to file a level 2. So we give you ample time to definitely dispute the claim. And, you know, and of course, you have, again, your provider relations representative to be able to take those avenues and assist you to triage that internally for a different level of review as well.
Right. Okay. Thank you.
So we get this all the time about, you know, member status and suspension. If a member is in suspension status, your claims are going to pend what's called LZ. That means the member is suspended, they're kind of active, you're still allowed to submit claims on the behalf of the member. They're going to pend, because for the members that receive the advanced premium tax credit, those will be the only ones that get the 90-day grace period. So we have to honor that, and that 3-month grace period, you know, if they get services, if providers are okay with giving them services during that time, those claims will hit the system and pend. We will be pending for the member to go ahead and pay their premium, and which at that time, there's a next breakdown here, which will tell you. So if January 1st, the member pays their premium, they're great to go. February 1st comes around, the premium is due. Hold on. The premium is due, the member does not pay, we immediately go into the suspend status. March 1st, the member's placed in, well, March 1st is when the member's initially placed in the suspend status. Once you go in and you check eligibility, you will see that it will flag it right down for you. April 1st, the member remains in suspended status if they still haven't paid their premium. If the premium remains unpaid by the time May 1st comes around, which will be the 3 months that we have to honor the members, at that point in time, the member's now terminated. And what winds up happening with all of those claims that sat and pended, they all drop, and they'll deny. I don't know how it generates on you guys, but it's going to deny what we call an EX28, meaning the member is, its member's not active. And at that point in time, the provider is allowed to bill the member. However, if the member does pay, then of course all of those claims will go ahead, drop, and adjudicate business as usual. Okay, what are some really important things when submitting a claim so that it's considered a clean claim and it can come over and be processed and paid without additional barriers? Is taxonomy is very required on all of our Ambetter claims. Taxonomy code must be on there, and it is necessary. If not, your claim will reject. If you're doing any labs in-house, in office, a CLIA number is required and must be appended in box 23 on your claim. If not, your claim will reject for no CLIA number appended on the claim. Billing the member, co-pays, co-insurance, and deductibles. Co-pays, co-insurance, and any unpaid portion of the deductible may be collected at the time of service. Deductible information, including the amount that has been paid toward the deductible so far, can be accessed via our secure portal. So when you log in, I showed you guys the whole breakdown of information. It has deductible information, co-payments, family plan versus individual plan. So it has a really good breakdown for you guys to be able to see everything. If the amount collected from the member is higher than the actual amount owed upon claim adjudication, the provider must reimburse that member within at least 45 days. So if you collected more than you thought you should have, the claim processes and you realize the deductible was way more collected than what was paid out, that member has to be reimbursed their additional dollars within 45 days.
Blanca, let me interrupt you for a quick question. I should have asked this earlier. Something about how someone asked how they will know if a claim is suspended.
Well, a claim would not be suspended if you submit a claim. So if you're verifying eligibility, it is up to you guys whether or not you want to still see the member in suspension status. The minute you go into the secure portal and you populate that member's information, it's going to tell you that the member is suspended. So at that point in time, it is to the discretion of our providers if they're going to see the member. And if you do, what we're saying is that those claims are going to be submitted, but they're going to pend. I'm not quite sure how it transposes on your guys' 835 file, but it's going to pend LZ, which means pending for the member to pay their premium. So if the member is an APTC member, they get 3 months before we terminate. So hopefully within that time, and that's another thing, they can't just pay for that month. They'll have to pay for everything that is owed. So if they were supposed to pay February 1st and they missed February, March, and then in April they're going to have to pay for February, March, and April, and then they'll go ahead and be current and be made whole again. So anything that was pending for that member will drop to pay out, and if they get terminated, it will drop and then they can be billed. So it's one or the other.
So on the eligibility, it will show the member is in suspense. Most do
Absolutely.
not show. How often is this updated for insured status?
I was told within 24 hours.
Okay.
I think they give the members until midnight of the last day of the month, if I'm not mistaken, but I can get that for you. And then it's updated, and then you'll know for sure.
Okay.
In the morning, every morning when you log in for whatever member, it should tell you what is true. And if for whatever reason, if you get a member and they're in suspended status and they're there and they want to pay everything current, they're able to make a phone call and do it over the phone and get that all current, and then you can move forward with appointments and do what you have to do on your end.
Okay. Had a question about a denial code. What is the denial code on claims missing a CLIA number?
I don't know how it's going to transpose for you guys on the 835 form. For us, I think it's a C4, and it will tell you CLIA. It will say CLIA, CLIA number missing, or it's expired or something. If you put the CLIA number on there and it's not, and it's rejecting back out, it's because either the CLIA number is expired or the CLIA number is not on the claim. But I don't know how it transposes to everyone on the 835, but I can definitely tell you on our end, it will say CLIA. It will give you a clear indication that it's a CLIA number issue.
If anybody else on the call is familiar with that and wants to just chime in either the chat or the Q&A, please feel free to do so, of what that looks like on the 835, a denial code for the missing CLIA number. Thank you.
And depending on what system you guys have, it's probably going to transpose differently. But if you're looking at your EOPs from PaySpan, it's definitely going to tell you CLIA, because all of our denials give you codes, and at the very bottom you'll get a description of what the codes all mean.
Okay.
Like a little description table at the very end of your EOPs.
Okay.
And so PaySpan is what we utilize. That's our vendor for EFT. If you already logged in with Penster or registered with PaySpan, you'll have to call and let them know that you are now participating with Ambetter so that they can go ahead and set you up for Ambetter. And so this is just basically what I kind of explained a little bit as far as your claims. A provider must exhaust the claim reconsideration and dispute process before filing any type of complaint and grievance on a claim. So let's just say you have a high dollar claim. And guys, I say this to say many times people call in for their claims, for these high dollar claims. And this is where I highly recommend that the use of your provider relations representative is used during this time. The call center is extremely useful and we definitely appreciate all that they do. But when you have a high dollar claim, that's not the reconsideration process. The reconsideration process is filing a level 1, a level 2, and then appealing your claim. Some people have been calling in and are assuming that, you know, something is reprocessing or changing out and nothing gets done and goes straight to a grievance appeal. Your best route in trying to get the resolve for a high dollar claim is definitely reach out to your provider relations representative. And hopefully you guys are having what we call JOCs and monthly meetings where these type of claims can be brought to the table and immediately expedited for review and closed out expeditiously as well. So that's always my tip on that. And of course, complaint and grievance must be filed within 30 calendar days notice of action. And upon receipt of complete information to evaluate the request, Ambetter will provide a written response within 30 calendar days.
Blanca, a couple questions that came in.
Sure.
Real quick. If the patient is in a suspended status and ends up terminated, is Ambetter billing the patient for the premiums for Ambetter or the hospital liability? They just want to clarify.
So what do you mean billing the liability? For the claims that are on there, for the claims that will process out, the provider will bill the member. They will drop and the provider is able to bill the member for the services. So at that point, the claims are denied outside of our system. They're going to deny member suspended or member terminated, which is like an EX28 for us. And I'm not sure what it transposes for you guys. Did that answer your question?
Let me ask. Monica, did that answer your question? Just give me a thumbs up or whatnot if it did. Or clarify if you'd like to. And then the other question while we're waiting on that is, are providers still using the Medicare rates effective 10/1/2015 to determine Ambetter payment rates? Or are there...
Medicare Ambetter weights and rates would be subject to a contract. So if somebody wants to know what we're using today for them specifically, I would please email me that information, your tax identification number and your group name, and we can look that up and give you more specifics around that.
Okay. Yes, and she said you answered her question appropriately, so she appreciates that.
Awesome, thank you. Any other questions before I move on?
I think, give me a second. Yeah, similar question. I think is the provider able to balance bill a member with a suspend status? If they bill the member during this time and the member pays the premium and the eligibility is retroed, how would this impact refunds?
Say that question again, I'm so sorry.
Can the provider balance bill a member with a suspend status if they bill the member during this time and the member pays the premium and the eligibility is retroed? How would this impact refunds? So
let's backtrack what I said a little bit. So number one, there's no balance billing. If you're an in-network provider, balance billing is prohibited. So that's first and foremost. Secondly, we allot for the APTC members the 3 months, the 90 days. Within those 90 days, remember, if the member does not pay, they're terminated. So they can't come back in. In other words, they can't on the 30th, 90th day just say, hey, okay, I decided I'm gonna pay for all this, because at that point they're termed out. So they'll have to follow that process through Marketplace, however that works out. But the claims and all the services that were rendered to that member during that suspended status, that those claims were pending, will be all the claims that will drop and the provider can bill for those services only. So in other words, there's no in between. So the member either pays on time and they make themselves current, they bring themselves current, and claims that have been in holding status and pending will process and pay out, business as usual, or the member just doesn't pay, and then they're termed, and then unfortunately they will have to be billed for those services.
Okay.
So in other words, there'll be nothing for the provider to reimburse the member back on.
Mhm.
Once they're termed, I mean, they have to pay for those services that were rendered.
Okay.
Does that make sense?
Yeah, I think so.
Any other questions?
Not right now.
Okay.
It's
Okay.
20 till, just a time check.
Okay. Medical necessity must be filed within 30 calendar days from the notice of action. Ambetter shall acknowledge the receipt of your medical necessity file in 10 business days. Ambetter shall resolve each appeal and provide a written notice expeditiously as the member's health condition requires, but not to exceed 30 calendar days. And of course, if this is something that is urgent and seriously can impact the member, we will definitely expedite these appeals immediately. Not to exceed 72 hours, for sure. Member representative, members may designate a provider to act as their representative for filing appeals on their behalf. That is outlined on our unsecure side in case a member does ask you guys to assist on one of their claims or filing an appeal regarding one of their services and claims that need to get processed and paid out. No punitive action will be taken against the provider by Ambetter for acting as a member's representative. And need more information, of course, you can go out to our Ambetter website on the unsecure side, and there's lots on complaints, grievances, claim disputes, and the provider manual and so on. Policies, all that good stuff is out there for you. These are our vendors. We have NIA for our imaging services. We have Involve for our vision benefits. We've got Dental Health and Wellness for our dental services, and Involve for our pharmacy solutions. All of their contact information and emails can be found here, and once we provide this to you, Bill, our providers can have that as well.
Thank you.
All right, so I'll open it up to a few questions.
Let me see what else we got here.
Sure.
Does Ambetter follow the Medicaid guidelines for 10 visits yearly? If not, what's the authorization process?
So that would have to be look up per package, and Ambetter wouldn't follow Medicaid guidelines. Ambetter is, is commercial, so it follows a different type of guideline. But in the hyperlink that I showed you all, that benefit package will tell you how many visits that member has per their insurance that they have, their package that they have for Ambetter.
Okay.
Mm-hmm.
It looks like that might be our last question. Let me check here real quick. Nope, got one more here, hold on. Oh, she was just acknowledging that you answered her question, so thank you. Yes.
Okay.
Anybody else have any other questions before we wrap up here today? Feel free to drop that question in the Q&A section at the bottom. I think I have a question that I may have missed from earlier. And I apologize. Tell me if this makes sense or if we need to rephrase it in some way.
Okay.
Let's see. Does NIA prior authorization for both the imaging and the point of service and let's see. Mary, I'm not sure I fully understand your question, and I'm not sure I'm asking it correctly. I'd be glad to let you ask it yourself and give you the ability to speak if you want, or if you want to rephrase it. It just says, does the NIA prior auth for both the imaging and the point of service, and the same question for pharmacy, involve? Let's see. I apologize.
Oh, no, that's okay. You guys are more than welcome. You're also more than welcome to send me via email too, Bill, and we could, you know, get them some feedback and perhaps some contact information if it's something within the pharmacy and NIA that, you know, somebody's needing a little bit more understanding or assistance when it comes to those. I can definitely.
Hold on here. Do they issue the PA for both drug and point of service?
Who? NIA? NIA is only going to do imaging, and then pharmacy has their own process.
Okay.
So no, NIA doesn't do both. NIA is imaging only, radiology stuff, and then you have our pharmacy department that deals with authorizations on that side, on pharmaceutical side.
Okay.
And all that can be on our unsecure portal as well.
All right.
Mm-hmm.
Let's see. Nope, clarifying, need to, let's see. Let me do one thing. Mary, if you wouldn't be opposed, I'd love to give you the ability to just to ask. Let me see here. Just trying to find you on my attendee list here. Mary, you're welcome. Let's see, you're on mute, but you're welcome to speak now if you'd like to. I think we can, let's see if we can hear you. You may not be able to.
It may be double muted. Sometimes that happens too. I don't know.
Right.
I don't think I have the ability to. No, I don't.
Judy, if you had a question as well, I can, I think I can give you the ability to speak on this as well. Are you able to hear us? You're on, I still show you're on mute.
Yes, I have a quick question. Are we still using the Medicare rates effective 10/1/2015 to determine the Ambetter payment rate?
Yes, I answered that earlier to say that if you want something a little bit more specific on the Ambetter weights and what's being done today, I can definitely get that via email and check on your contract, because there's different setups for Ambetter. So it would really be what your contract outlines.
Thank you.
Yep, you're welcome.
And Mary, I've got you up, but I'm still showing you on mute. If you can get yourself off of mute, feel free to restate your question. I apologize that I didn't. Go ahead. Go ahead, Mary. Well, it's not showing you on mute. I can, it looks like you're off, but Mary, if you can hear me, go ahead and ask your question. We're not getting that coming through.
Mary, if you'd like to email me your inquiries, I would be more than happy to answer them for you, so that this way you can get some sort of response on what you need. Does that
Blanca,
help?
Can you share that with the folks? Are you able to share your email with folks? Do you mind?
Sure. Sure, absolutely. Do I put it in this little chatty thing? Let me see. Hold on.
Sure. Yeah, put it in the chat if you'd like, to all panelists and attendees.
So that's my email. And of course, I can triage your email to your specific dedicated representative. Please feel free to send over any inquiries, and we will be more than happy to get those responded for you.
Okay, Blanca has put her email down in the chat if you'd like to pull that out, but it's brodriguez@centene, CENTENE.com.
Mm-hmm.
Yeah, Mary's unable to use voice for some reason. I apologize. So, Mary, my suggestion would be that maybe you just send that question directly to Blanca, and I'm sure she'll get you an answer pretty quickly there.
Yes.
Okay. Blanca, I know you have a call at the top of the hour. I just had a couple things to share with everybody here, so let me do that real quick.
Sure.
Just have to find where I put it. Let's see. All right. Just wanted to show everybody. So this is the homepage for the Georgia chapter of HFMA. And if you, a couple things I wanted you to see right here, calendar of events, got a lot of great events coming up for the chapter, including a revenue cycle forum next week, as well as the chapter fall conference is a combination of virtual and in person. That's scheduled for November 4th, 5th, and 6th. But then as far as the presentations from today and from this week, I wanted to show you where those will be posted. So if you go over to the media tab on the chapter website and you drop down to document library, you'll see a section down there called In Case You Missed It. Click on that and that will give you a 2020 folder. Click on the 2020 folder, you'll see the Fall Pair Forum. And under that tab, we've got the recordings as well as the presentations so far from this week. We're still waiting on something from United Healthcare from Wednesday. And of course, Blanca is going to get proper approvals and get something over to me for Ambetter. So Blanca, we really, really appreciate your participation today.
Yes, thank you guys so much for having me.
We've only had you at a couple forums, one in person and one virtual, but we really appreciate it and look forward to continuing to have your participation down the road, and really, really appreciate that.
Oh, yes, definitely. In any way that I can help.
Yeah, just in the spirit, I thought this was appropriate for everybody. I know you're out there working really hard, folks, and I would just tell you to continue to do your work and try to be better today than you were yesterday, right? In the spirit of in the spirit of Ambetter, be better. So
absolutely. That's a good one. I love that.
Right. So
please
I just
let me know, everyone, if there's anything I can help you guys with. I'm always here. Thank you so much for having me. And I love all of our partnership. Many of you guys I recognize. And so, yeah, please let me know if there's anything we can do better. We're always trying to do better things. So
yes, absolutely. And I just want to thank everybody again for their participation this week. I know many of you were on several of the sessions this week. I hope it was productive. It's certainly our intention for it to be valuable for you. Thanks for everything. I hope everybody has a terrific weekend. Thank you for your support of Georgia HFMA, and we'll look forward to seeing you again real soon.
Yes, thank you guys so much. Enjoy your weekend. Thank you.
Thanks again, everybody.